Daniel Kessler was involved in a rollover motor vehicle accident in 1998 in Arizona. He suffered traumatic brain injury, or TBI, in that accident. Since then, he suffers from migraine headaches.
What I experience when I feel a migraine coming on is something akin to a C-clamp at the base of my skull. That's my indicator. If I can't get to my medications in time, it'll shoot behind my eye or to both eyes. And everything hurts.
Today, he's receiving his first treatment to hopefully prevent the headaches he gets as a result of TBI. Staff neurologist Major Maria Alvarez is conducting a study at Wilford Hall Medical Center in San Antonio, Texas, to find out if botulinum toxin, commonly known by the commercial name BOTOX, is effective in treating TBI headache patients.
More than 50% of our outpatient clinic diagnoses were migraine headaches, chronic daily headaches, tension headaches. But the bottom line is they have more than 10 headaches per month.
Botulinum toxin is already proven effective for treating migraine sufferers.
78%, or you can round it off to 80%, reported dramatic or robust improvement of their headache. And when we got closer, narrowed down some more, and we found out that these patients, majority of them, meaning 60% of them, reported at least 75% reduction of their headache. So these are the ones that are, if you look at it in a more simple number, if they are reporting 4 headaches per month before, now they're down to 1 headache a month.
Rebecca Swisher has suffered from migraines since she was a child.
It's kind of crippling. You become a migraine cripple.
For roughly 3 years, she's been receiving the botulinum toxin treatment.
I don't get headaches at all, period. No headaches at all. And if I get a small tension headache, it's controllable with Motrin.
Dr. Alvarez started to look at the data about the effectiveness of botulinum toxin on patients without TBI.
So because of these very strong and promising results that we have, we said, okay, now we're going to kick it up a notch, and we're going to apply the knowledge that we have on our non-traumatic brain injury patient and see if we can test and test it and use the same result. Hopefully we can see the same result in TBI-related headache.
Some TBI patients have symptoms of what can be called a mental fog and can sometimes have a hard time remembering to take their medication.
We can bypass the side effect, the grogginess feeling, the feeling sleepy, and they don't have to worry about, did I take it today? Oh, am I taking it tonight? I have to take it tomorrow morning. They just put in their calendar, they have a botulinum toxin or injection appointment at this day, and then write it again 3 months from now.
The goal of the study is to get TBI patients back to a normal life.
Bringing them back, improving quality of their life, taking away the pain out of them, increase their daily activities again, and then slowly they'll get back to their normal routine. I think that's very important. Get our men back to the service that they want to be.
If the study proves effective, the treatment can have huge effects on the military.
If they are on certain medication, they cannot be deployable, or they can't have their flying status. I mean, these are people who work so hard to get in that kind of status, and suddenly now they have headache, and it's like taking the life out of them. I mean, there's so many patients in my clinic, and they're devastated when they have headache, and they're worried, like, doctor, does that mean I can't fly anymore? And you can tell from their face the fear. Not from the pain, but the fear that they're losing, not that they're losing their job, they're losing that assignment that they wanted to do.
Lieutenant Colonel Patrick Grogan is the Wilford Hall Medical Center Neurology Program Director. He says one of the benefits of using botulinum toxin is it helps target the areas needing treatment without the side effects of traditional medication.
Those medicines come from a variety of different drug classes. We have antidepressant medicines, we have anti-seizure medicines, sometimes we use blood pressure pills, a variety of them. But a common side effect to all of them is some concentration loss, fuzzy-headedness, just some disruption in a normal person's concentrative and memory ability.
That's where botulinum toxin treatments can have a huge impact.
They have no effects on concentration, on memory, as far as negative effects, as far as that goes. and the patient really doesn't have to remember to take a daily medicine after that. So you get a potentially very effective treatment that the individual does not have to remember to take that. They come in once every 2.5 to 3 months, and then they don't get exposed to the adverse effects that really wipe out their concentration and their memory, which again is part of that TBI spectrum.
You just have to get used to the needles. To Rebecca Swisher, there's no comparison.
It's a small pain for a few seconds to having pain almost daily, because I was having a migraine every day or every other day. And so when you consider that every day or every other day to having a few seconds of pain and no pain for 19 weeks, what would you consider?
And perhaps for TBI patients like Daniel Kessler, the future can also be pain-free.
If I can shorten those durations, eliminate them, get off of medications for the rest of my life, that's my aspiration. And I know it might not be realistic, but I'm willing to try anything right about now.
And through the TBI study Dr. Alvarez is conducting for patients like Daniel Kessler, that goal may become a reality.
We're done.
Oh, I was waiting for you to get started.
Tech Sergeant Steve German, Wilford Hall Medical Center, San Antonio, Texas.